members of this network have the same goal to tackle fraud and corruption and waste. So I strongly believe that we must enhance the collaboration between us and to share good practices in order to achieve the shared goal we have. And this is what we must do. This is what you're doing all those years, and this is what we must continue to do.
We see that change is everywhere around us. It's about new entrants, it's about high expectations, about new technology. And as supervisors, to be effective, we need to be on top of that.
Well, we think that healthcare is in rapid change, and these changes do not limit themselves to national borders. So the opportunity to exchange ideas, to learn from each other, and also to see with international colleagues what their best practices in their countries are, that is very helpful for our work. And what we noticed last year at the open house in Athens, that there was a lot of interest in our approach to working together with chain partners, but also to apply behavioral insights in our supervision and regulation. So that inspired us to be the host of this event today.
It's always a good idea to work together with other supervisors or instances to make the healthcare better. But it's also really important to look in what kind of situation you are. If you are in a situation where, for example, hospitals don't embrace the thing you would like to achieve, then it's useless to do it. We started first by talking to hospitals and they didn't embrace the problem. Well, then you can stop working together. But if they do, it's a really powerful instrument to make healthcare better in your country.
To really innovate, it's important that you take some risks and sometimes step out of the shade, of your own shade. And so, for example, we contacted a journalist and invited him at the office. Well, they did well.
Well, there are many benefits, but the most important ones are that sharing information can help you in solving a case, but also to get a better overview on the fraud in healthcare. And it can also help you to stop the flow of money that is going out incorrectly. So there are many benefits, but there are also some limitations. We're talking about sensitive data most of the time, so there are more restrictions than general data. And I think in our case, we are criminal investigators, then sometimes you make a decision not to share information because you want to be lower profile when you still investigate the case. So I think that are some limitations.
Yeah, so what we find is that to determine what the public value is of our governmental supervision on quality of healthcare, that's what my regulator does. It's very important to look at four perspectives: the perspective of the patient, the professional, the politicians, and the public. And these four perspectives together, combined, form the public value, the added value that we have. So if we miss out on one of these perspectives, if we miss out on the perspective of the professional, for example, so if the professional doesn't feel that what we're doing is right or that we're not doing the right things, then we're in trouble as a regulator.
We are developing a new project, which is the anti-fraud unit. Our aim is to change the way we work through an intelligence-led approach to inspecting and auditing. And we expect that through this innovative way to transform data into info, we'll be able to improve our decision-making process and hopefully become more accurate and ensure better use of public resources.
New tool is the registry for medical devices, an electronic registry that helps us to categorize and classify all the medical devices and food for special medical purposes. By applying the registry, we were able to uncover a big fraud case, specifically a food for special medical purposes was never imported in Greece, but on the other hand, it was reimbursed for 9.5 million euros. So with the electronic registry, we had the opportunity to uncover this fraud case.
Well, as our world changes, it also means that our approach to healthcare and to supervision changes. So we try to use more data and data analysis to make risk-based supervision. We try to not just solve things once they have gone wrong, but to see if we can prevent them on beforehand. So we use different types of tools, not just formal interventions, but also more informal interventions and soft controls. And of course, there is the important matter of legitimacy. You need to be connected to the public and understand the problems with the public to really do your work as an agency well.